Okay, we're finally doing it again. I'm sorry that the earlier recording or live, YouTube Live didn't work. So now we're back to doing some questions and figuring out this YouTube Live thing so we can do questions like we used to do on Periscope back, I don't know, a year and a half ago, and we were really doing a lot of that. Somebody did come on just, I don't know, it was like 20 minutes ago that we tried this before, and was asking a question about craniosynostosis. Apparently they have a child who had this and had surgery recently. Crainosynostosis is a condition where the bones are fused together in the cranium when the child is born, and so you can get some deformities, especially with growth, because the bones grow but they're already fused together, so you get these hey, did it again. Yes, we're doing it again. We're doing it now. We're doing it live. So you get these deformities where you'll oftentimes, it depends on which suture. We call them sutures, where the bones come together in the cranium. If it's the horizontal or the longitudinal sutures that fuse, you can get these deformities of the head that have it being real long, almost like alien. You know how the head is really long and still rounded but elongated. Or you can have them going sideways too, if the sagittal suture is the one that fuses. So the growth keeps going where it's not fused. I'm on break at this time. Yes, this is a lunch hour here on the West Coast. It's the noon hour. Hi from Canada. And some of Canada has the noon hour now, those of you in the Pacific time zone. Those in British Columbia, which is a beautiful country. Maybe I'll get up there again one of these days. We'll see. So that's what craniosynostosis is, and surgery, of course, is to go in and cut the bone so it's not fused together. It has room to grow. Where are I? I'm in the chair. I'm in the doctor's office at the Auburn Medical Group in Auburn, California. Dr. Mark Vaughn, Family Medicine, and YouTube. So, moving on to any other questions, if you guys have any, since we covered the craniosynostosis. I hope the person who asked that question was able to hear what we were talking about there. Actually, they probably know everything I just said if their child is going through it, I would guess. Yes, Samantha, that is correct. Okay, so who else is out there, or any other medical questions that we can go ahead and do? If you guys want to do medical questions, it doesn't have to be medical. You know, if you have questions about just the policy, the government side, business of medicine, I'm open to those questions too. Hi from Canada, yes, British Columbia. Hope to get back up there someday. Some great television production going on up there, since it's yet another industry that the United States has exported. So, and British Columbia has benefited greatly from it, with a lot of good shows that have been done up there. And then Georgia. Who would have thought Georgia is where a lot of these great new shows are coming from, and a lot of movies from Georgia too. Hello from Pennsylvania. Yes, hello Sharon. A lot of good movies in Pennsylvania. Just watched one this week, last week, that was made in the Philadelphia area. Hi from Jessica from Placerville. Welcome back. So Jessica, yeah, we met through the YouTube. Was it YouTube Live, or did you comment on one of our regular videos where you said that you were? Yeah, it was one of our regular videos on YouTube where you'd commented that you were in Placerville. And yeah, it's cool to actually have somebody kind of somewhat nearby. When are you going to do another earwax removal? Oh, I'm glad you asked, Samantha. We have this afternoon a gentleman coming in who not only has an earwax removal, he has bilateral earwax removal, and all the way plugged. The cerumen is totally occluding the outside portion of the ear canal. We don't know how deep it goes because we haven't looked yet. So both ears, and some of you are going to go crazy over this. He also has some good blackheads. We haven't done blackheads for well over 6 months, I think. Yes. So we're going to make 2 videos out of it. We're going to make one for the earwax removal and one for the blackheads. And you know, if I was really milking it for all I could get out of it, we'd make 3 videos: one for his left ear, one for his right ear, one for the blackheads, or maybe the blackheads on his face, the blackheads on his back, or anyway. We probably won't actually do more than 2, but it's going to be good because we get a lot of views on those. It really seems to get the channel a lot of attention on YouTube. The only thing that I don't like about it is, you know, so some doctors love being the blackhead doctor on YouTube, and that's great, and they do a great job. I since I'm a family physician, I want to not just be pigeonholed into that. Although the ears are fun, and we do a good job with ears. So we can kind of have the ear thing. And I remember for a while we had our people commenting, making up a lot of alliteration names for what we do with the ears, like cerumen captain. Oh, that's not true alliteration, is it? Anyway, they had different names that they were coming up with. Now I'm not seeing, where is it? Where we see how many people are on or how many comments are coming up. Show comments. Where is, oh, it's because I have this filter, or not filter, this lens over where it shows how many people are on. So we got 15 people now. And you guys are welcome to ask medical questions if you want. The reason I use the wide angle is because, well, I'll do whatever you guys tell me. Which do you want? Do you want the oh, put that back, normal. Oh, there we go. My favorite procedure, hard to say. Earwax removal, love to see that one. Okay, how do I make the comments stay? Does anybody know? Okay. Hello from Oklahoma. I need to get rid of. Oh, and I can go back through the comments and get caught up. Favorite procedure, ears are pretty cool. I like cutting too. Ear removal ones, I need to see that. Typo, can people give dogs colds? I do not know of giving dogs colds, actually. Thumbs up for Cerumen Nation. There you go. Good. Oh, Dr. Gawain. He must be at home. Am I going to film? We're going to this afternoon. Hello from Oklahoma. I missed your live video yesterday, but wanted to tell you I love your shirt. Oh, that color yesterday. Yeah, my wife got that for me a couple weeks ago. It is pretty cool. Thank you. Okay, I think I can get rid of that by hitting that. Show comments. Without lens. Oh, thank you. Yes, Samantha and K-Dot, thank you. Do I know Dr. Paul? Sort of. She's referring to Dr. Paul Thomas, I believe. Dr. Paul Thomas is, he was not involved with all of the other YouTube doctors when we did a roundtable months and months back. It was with Dr. Carlo Aller and Dr. John Gilmore and Larry Mellick, emergency medicine physician at Augusta, Georgia, at the university there, and myself. And the four of us did a roundtable, a Google Hangout, and it's available on all of our channels, I believe, where we're just talking about what it is we're doing and just kind of getting to know each other, because it was the first time for, at least for Dr. John Gilmore and myself to speak. Larry Mellick, of course, I interviewed with him back at Loma Linda in the 90s for residency position. And then Carlo Aller and myself, we've had communication back and forth separate from this roundtable. And Dr. Paul Thomas was not a part of it, although I had spoken with him, but I guess nobody else in there really knew who he was. He has over 200,000 subscribers last I checked. He's in the Portland area and does a great YouTube channel with a couple procedures a week, kind of like ours. I'm sorry, not always procedures, I'll say cases. He's a pediatrician, so it's children, almost exclusively children. Every once in a while he'll have, clean out his wife's ear or something like that, which does as well as my ear cleanings as far as views. A great guy. I love watching his videos. You feel good after watching his videos because he's always smiling and he makes his patients better. Okay, K-Dot wrote something here. Let's see if I can find it. Okay. Yes, okay, so you do know Dr. Paul Thomas. Could you do a compilation of the best earwax removals of 2016? Greetings from Germany. K-Dot, thank you. And the suggestion is a very, very good one. We may yet do that. It could happen. Maybe it'll be put to music. Maybe it'll be a music video. We'll see. Okay, and then, do you have any tips for medical students like me? Falguni's a medical student. What's the craziest injury that's come into your office? Advice for medical students, make sure you love medicine, because the way that the industry and federal policy are going, you've got to love serving your patients to do it now. Also, I would encourage you to be very realistic about money, because with the cost of medical education going up, but reimbursement for primary care physicians not going up, it's becoming a very tight squeeze on people going into primary care. So You have to really be in it for the love of it and not for the money if you're going into primary care. But as a primary care provider, I can tell you there's a lot to love about it. Having that long-term relationship with patients that the specialists, some specialists have long-term relationships, but it's different with family medicine. Plus, you're able to take care of a lot of things, which is both a curse and a blessing of family medicine, because the blessing is you get to take care of lots of things. The curse is there are a lot of people with a lot of medical problems, and they'll come in and they'll need attention for their uncontrolled hypertension. They'll need attention for their uncontrolled diabetes, and not because you haven't been working on it, just you don't have full control of what these people do for activity and what they eat. And you're prescribing the medicines, and then they say, oh, but I have this and I hurt and I want this addressed. And in family medicine, you can't just say, oh, go back to your primary care provider for it, because you are the primary care provider. It is your responsibility. And sometimes the temptation will be to just refer out, just because you got to get these things addressed. And you can't do it all in one visit and still get to the next patient. And you do need to see a certain number of patients in order to pay the bills. So primary care has that mixed blessing. I encourage you to consider that very carefully. Somebody asked the craziest injury that's come into your office. I remember that on a Periscope we once did the craziest case we'd ever seen, and it's actually available if you search for weirdest thing, I think, for Dr. Gawain. You can find that on YouTube. Craziest thing for me, I remember once in residency, I was intubating a patient, putting a laryngoscope in, pushing the tongue and the lower part of the jaw out, looking down the throat from above, because you're at the head of the table. And being able to, after the car accident that this patient was in, kind of see what I was doing as far as guiding the laryngoscope to pull back the epiglottis in the back of the throat. And I was not doing it through the normal view. I was doing it through a cut that was somewhere in the nose, and I was looking down into the throat through that instead of through the open mouth. That was pretty crazy. I don't remember how that patient did. And that's an interesting thing. People will talk about these crazy cases they've been involved with in their training time in the emergency department or early residency, and they'll be able to tell you more of the outcome of the patient. That's one of the things about emergency medicine is once you get the patient all packaged up and surgery takes them away, oftentimes you don't get follow-up. You have to really work at trying to track down specific patients, and there's so many in every shift, and you've got another shift the next day, that it's really something to keep track of what happened to a patient in a trauma like that. So I don't know what happened to them. Okay, moving on to the next. Okay, what time is California? It is 12:56 in California, and it's, how about that, same time as in Southern California? Isn't that amazing? Do you ever laugh at crazy stuff? Absolutely, we laugh. We laugh with patients, and try not to laugh at patients. We respect them, and try to go through it with them. Try to make it fun for them, help them to see the humor in some of the pain that they go through. And you'll see that if you watch our channel, you'll see that we're laughing with the patients as we're doing procedures with them, even though it may be a cancer that we're working on. It will still, there's still life to be enjoyed even in the midst of that. And that's a big part of the motto we have here of going to the doctor can be fun, or going to the doctor is fun. And I hope you guys experience that too. I think it's been expressed quite often on your comments on our channel. Okay, can I use warm water to wash out my earwax, or do I need another ingredient? Well, first of all, washing out ears is not something to just go ahead and do, and the reason is because I don't know what the state of your ears is. There are people who just naturally don't have closed eardrums, and they don't know it. And getting water in there can cause horrible middle ear infections. So when we do washing here, we do all we can to know the state of that eardrum before it got to this place. And sometimes we will go ahead and irrigate even though we can't visualize the eardrum, but it's because we don't have any history of ear problems, and maybe we've seen the ear in the past in the office. And then when we do use irrigation, we'll throw in, about 10-20% of the volume is hydrogen peroxide rather than just water. We make sure the temperature is very warm but not so hot that it's going to be painful. And that's to avoid having horrible nystagmus that can be caused by water the wrong temperature. Nystagmus being the eyes are going back and forth like this. That, oh, somebody's trying to break into the room. He's using a key. Somebody who commented earlier, actually. All right, what other comments are we not seeing here? Hello, Dr. Gwain. How do you react to the work in the first year of medical school? Do you like dogs? Some dogs. Do I like your dog? When she's not climbing all over me and making me smelly. Yeah. Do you like your dog?
Sometimes.
I don't know if you can hear him. He said sometimes. All right. So with Dr. Gwain's arrival, it makes me realize that the little time here on my phone is not the time. It's the time elapsed of the video. So I'm actually getting really close to lunchtime. Thank you guys so much. We touched barely on medical topics, not a deep discussion of any particular thing this time. Maybe we'll get more into a particular topic in the future. Maybe I'll even set it ahead of time so that we're not dependent on somebody coming up with a specific topic. Thank you so much. Please do continue to be subscribed to the YouTube channel and share with your friends when you see a case that you think they'd enjoy. That helps us all out. And those of you who like Patreon, check out the Patreon page. It's Patreon/Auburn Medical Group. No, Patreon.com/Auburn Medical Group. And they get these videos after they're done, because they're open to everybody when they're live, and then after they're done, I keep them just pre-recorded for the people that are on Patreon. They're the only ones that have access to these. But you still have access to all the regular videos, even if you're not there. We like to have everybody watch. So, Brianna, you're very welcome. Till next time, Dr. Mark Vaughn telling you to stay in good health.